Hello, this is Eric Fishman with EHRtv, and today we'll be discussing personal health records and electronic health records with Congressman Richard Gephardt. Congressman Gephardt, it's a pleasure to have the opportunity to speak with you, and thank you for your time out of your very busy schedule. You, more than anybody, have had an extraordinary interest and experience in health information for decades as one of the architects of HIPAA, and now with the American Recovery and Reinvestment Act of 2009. I think you're probably pretty excited about finally a phenomenal increase in this activity. I wonder if you could tell us about that.
Well, health IT is critical to making the healthcare system work better, to be able to get the data we need, to be able to improve the quality and to control the cost of healthcare. And we've talked about it forever, but now we're finally beginning to do something about it. The stimulus package that the Congress passed a few weeks ago is really the first big serious step the federal government's taken to really move the needle on this subject. So it's exciting. It's very, I'm sure, enthusiastically received by the entire healthcare community, and now we just need to get the money spent and get the health IT bought.
It's a couple orders of magnitude or more funding for health IT, and that certainly should move the needle quickly. Right. There might be said that there's a dichotomy in health information. Is it owned by the physician and it's their medical record, or is it owned by the patient? And I understand that you're on the board of advisors of a company that has a product, My Medical Record, and I've seen it. It's a wonderful personal health record. I wonder if you can tell us about that.
Well, it really is a very competent personal health record, which I feel very strongly about, both in terms of personal privacy, which is very important to every individual in the country, but also in terms of engaging individuals in their own healthcare status and in their own healthcare practices. If we leave all of the IT with providers and clinics and health insurance companies, we're really not going to adequately involve individuals in their own health care. And I'm a big believer in education and information and engaging individuals in what they have to do to keep and improve their health status. So I think mymedicalrecords.com is a very important effort in that respect.
When I was a medical student, and it was obviously many years ago, one of the sentences I remember hearing loud and clear, speak with your patients, they'll tell you what's wrong with them.
Exactly.
And the first two letters of My Medical Record says it all. Now, there aren't many people who know more about HIPAA than yourself, and I understand that the Stimulus Act does change the HIPAA application to some of the personal health record entities, and I wonder if you have any information you'd care to share about how HIPAA compliance, which as a physician I need to be very mindful of, how that applies to some of these personal health record entities.
I don't think there's going to be a big change. I think the original HIPAA provisions, which are very important for people's privacy rights, will still be in place. I do hope that some of the monies that go to providers, doctors, hospitals, other providers for healthcare IT will flow into individuals so that individuals get some financial help, because I think the only true way to have privacy is to have everybody have their own personal set of records for healthcare.
Is there anything else you'd like to tell our viewers on this subject?
Well, I just think we've got a great healthcare system, but it needs to work better than it does, and health information is an important part of that. I'm also working in the area of innovation with some of the universities and biotech and pharmaceutical companies. We need to do better in that area. And finally, we need to get people more engaged in their own healthcare status. If we can do those three things, I think we'll have an optimal healthcare system in this country.
Do you believe that the Stimulus Act will in fact accomplish its stated goals of having an interoperable nationwide health information system in the near future?
I think it's a very good start. I'm afraid it's going to cost more than $18 or $20 billion in the end, but this is a great start, and it's something to build on for the future. It is amazing to me that we can be in 2009 and still be so far behind in terms of applying information technologies to the healthcare field. I'm on the board of a number of companies that do different things. One of them makes steel, one of them's in telecom, one of them's in other areas. They spend millions of dollars on information technology.
Healthcare certainly does spend a smaller amount of their budgets on IT than many other industries, as you've just alluded to, and I think that's changing immediately.
It has to.
I thank you for your time, Congressman.
Thank you.
I appreciate it very much. This is Dr. Eric Fishman with EHRtv, and we've been discussing personal health records with Congressman Richard Gephardt. Until next time, thank you.